Hello, my friend and supporter. Welcome to medical science class at student medical science. How to the things say we deliver the now, my friend and supporter. In case of literature, I already given write down a poem and 12 alphabet 12 line. That kind of I write down. Give to my Facebook. Now medical science class, not literature class. What is science? Science is what is medical science? Medical science is the branch of science described creation life. Scientific name of commercial humans. Now medical science class. We learn medical science. What is the treatment protocol of addiction? What is the treatment protocol of addiction? In that case, prevention is better than cure. Prevention is better than cure. User take addiction. What is the treatment protocol? Symptomatic treatment. Symptomatic treatment. What is the policy? Check the vital sign. What vital sign is abnormal? What is the reason? Give solve that problem. And in case of unknown poisoning, that is also same policy. Symptomatic treatment and what is the problem? Solve that problem. Check the vital sign. What is the problem? Solve it. In case of unknown disease, symptomatic treatment. What is the problem? Find out that, then solve it. In case of unknown disease, check the vital sign. What vital signs show problem and solve that. That is the simple policy. By that policy, we treat the patient. So we discussed about addiction treatment. Also, symptomatic treatment of unknown poisoning and unknown disease. Symptomatic treatment of unknown disease. Treatment protocol of unknown disease. Treatment protocol of addiction. Treatment protocol of unknown poisoning. Treatment protocol of unknown disease. This is the simple policy. Then every disease, prevention is better than cure. Prevention is better than cure. Now, how much patient? Yeah, yellow shafi, yellow happy, yellow happy. Anarabdul Manush, shafi, Anarabdul Manush, happy, Anarabdul Manush. I am a simple creation of Allah. You know that for understand that I take ganja. That is enough. That is enough to prove that I am creation. Addiction and smoking is a very bad habit. That is enough to prove that I am creation. Simple creation of creator. As a Muslim, realize the one of the creator is a lot of creation. Now you see the what is the vital signs? In case of patient, you check your pulse. Adult pulse equal more or less 70 beat per minute. In case of children, more. Neonate, infant, children pulse, adolescent pulse. Check that child pulse more. Then respiration rate 16 to 18 breath per minute or more. Then temperature equal more or less 97 degree Fahrenheit. Then your bowel movement, evacuation, urination and stool, normal area out of the stool, normal or not. Then you feel the any pain, just like eye ache, headache, earache, nose ache, throat ache, body ache, abdominal pain, abdominal discomfort. How you check the patient? That is for that. Head to toe. You check the patient head to toe. First see the you have any headache, eye ache, earache, nose ache, throat ache, and running nose, redness of eye, sign of inflammation, see on face of mouth, rubor, color, dollar, rubor, redness, color, raise of temperature, dollar, loss of function, tremor, swelling. Whole body, check the, say to doctor, just take history, then go to the chest, coughing present or not, and heartbeat normal or not, and heart sound audible or not, or heart sound normal or not. Then you check the vital sign like abdomen, bowel movement that per minute 1 to 2 or more, increase or decrease, bowel movement, and painful urination or not, and body ache present or not, in case of pain, and in case of death, traumatic injury or not, head to toe, in case of nail, that is the simple policy, simple case. Without investigation, how you diagnose disease and give the treatment. I also utilize that policy, that head to toe, and find out the diagnosis. In case of find out the diagnosis, not write down that diagnosis. By that diagnosis, remained in my mind, and what is the treatment I give. Now my friend Mesabuddha, that is the simple policy to how diagnose patient and take the patient. And if not possible, then given routine examination, patient is not give history or you are not understand find out the disease, then give the routine examination, CBC, complete blood count, PSA, everything. Then chest X-ray, ECG, RBS, random blood sugar, urine RNA, urine microscopic examination. Maximum 90% disease come out to the equal more or less 90% disease come out 90 more than 90% equal more or less 90% disease come out to routine examination. Then go to the specific examination. In routine examination, there is a clue. By that clue, you go to the specific examination and specific investigation. After treatment given, patient you take the consent. You are feel better or not. If say better, consent given. In case of hospital, with document evidence. Thank you very much, my friend. Today is an